Thursday. We're excited to have you here with us today. Somebody in the Q&A, good afternoon to you too. And today we're excited to have Dr. Oscar Gidua with us. Dr. Oscar Gidua, how are you?
Hello.
Hello.
I'm well, Doc.
Yes, it's good to hear from you today and to see that you're doing well. We're excited to have you once more again in this conversation.
Thank you.
Asante for always being there for us.
Asante.
Mariana, good afternoon to you too. We're happy to have you here with us. So today we're going to talk about management of mental health issues during and after COVID-19 disease. And we'll have a very interesting conversation. And in the Q&A section, please remember to put in your questions regarding the topic and also regarding any concerns you might have with mental health issues or anything that you need us to address regarding mental health. Please put your comment in the Q&A section and we'll be able to see whether we can address some of the concerns that you're having. So Dr. Gidua, without further ado, I'd like to hand it over to you to take us through this session. Karibu.
Thank you so much, Dr. Kalondu. As always, it's an amazing pleasure to be here with the team. I can see people still joining the call, and it's really exciting to be with the team from Kenyatta, all the healthcare workers who are working so hard during this pandemic to help us. Today, as Dr. Kalondu has said, we'll be dealing with the management of mental health issues and disorders during and after the COVID-19 pandemic in Kenya. And what I'm going to do now is to share my screen so at least we can actually have, let me see, management. There we go. Perfect. That's what I'm going to share. I hope I can actually be able to do the, there we go. Perfect. Can you see it clearly?
Yes, we can.
Okay, thank you, Doc. Great. So today we'll go through this, and of course, as you can imagine, the pandemic has brought with it a few questions, especially for those of us in mental health, to see how do we actually work with our clients, how do we manage the disorders or the anxiety that has been being talked about so much. Without further ado, I'll talk about how we'll organize our presentation today. We'll do a brief introduction and we'll talk about our context. And then what I'm going to do is we'll talk about 4 talking points that the team that we had been working with have really researched since March. And we're looking at as the key to actually having good and robust mental health care for people, especially given the constraints that we have right now that require us to have social distancing and things like those. So we'll talk about things like telepsychiatry, of course, telepsychology. We'll talk about digital prescriptions. This should also interest everybody who's in the pharmacy profession. We'll talk about psychotherapy, and then we'll talk about preventive as well as promotive mental health, and then we'll conclude with a few recommendations which we as a team came up with. As I told you when we were talking about this topic the last time, it's actually the product of teamwork between a larger group of people led by Professor Lukoya Tuoli, as well as working with myself, of course, with Dr. Chitai Boniface, Dr. Alfred Gitonga, Dr. Simon Juguna, who's also the Director of Mental Health in the Ministry of Health, also with Dr. Linget Ongeri, as well as Dr. Frank Njenga, who is a well-known psychiatrist. I'd also like to say that for this section of this presentation, Dr. Linget Ongeri would have been the most better place to actually make this presentation. However, because she was otherwise held up, she was not able to do it. But since we did this work as a team, she also told me it's fine because we have the rapport with you, we can actually share these findings that we had. As I said earlier, when we talked about the other paper to do with NPIs, non-pharmaceutical interventions, that at the beginning of the pandemic, we started working on a paper which turned into 3 larger papers, as well as a policy document. And the papers we talked about and I told you about was one on behavior change, Then this one that's on treatment and management and interventions. And then the last one, which I think next week we'll have a really exciting time to talk and share about the interplay between our cultures and spirituality and how they've been affected by COVID-19. Questions like, what do you do with people who have to be buried, but then you're burying them in ways that does not subscribe to your culture? Or what do you do with religious ceremonies when you have been told to social distance, to only have 100 people in the congregation, and also not to have anybody under the age of 13 or over 58? What are the implications? So we'll do that next week, and we'll see how to tackle it. But as for today, we'll talk about management and considerations of how to manage mental health issues. Also, I'd like to mention at this point that because we are also members of the Mental Health Task Force, we're still involved in disseminating the contents of the Mental Health Task Force report, which was released about 2 weeks ago. And we are really working, and I think we'll coordinate with Dr. Kinuthi at some point to see if it would be useful to have members of the task force in conjunction with the Ministry of Health to come and talk to people about what we found after going around the whole country to ask Kenyans about what they think about mental health. Of course, our context, we know what happened, that that what we now know as the coronavirus disease came on our shores maybe on the 13th of March when we were declared. We were told to, when it was actually announced that we had the first case. It had been declared a pandemic on the 11th of March. By mid-April, the whole world had experienced what WHO has been calling the pandemic of the century. It's interesting because even as we do this in reporting of numbers and seeing how the cases are modifying themselves, we're finding that we have only two countries, I believe, and the other colleagues can actually correct me if I'm wrong, but there are only two countries that have not reported their numbers or what is happening in their country regarding coronavirus. And we can guess one of the countries is North Korea. The second country is our neighbor, Tanzania. So I think if you really want to think about what is the implication of following this pandemic, we really need to be careful because we are now next to our neighbors, and we have to find out a way to diplomatically say, okay, we understand you don't want to do this, but can we really see the effects it's having also, because we need to be careful as we operate cross-border. We talked about the various things that have been affected by governments, by different health authorities, WHO, CDC, and the rest, who have come and said that we need to do, physical distancing. We need to do things like wearing masks, sanitizing ourselves, and washing hands, and such other regulations which are known to slow down the spread of a pandemic and a virus like coronavirus. So even as we are doing all of this, the one thing that we've seen is that because of asking human beings not to be together and to actually socially isolate themselves from each other, we are finding that there are other effects beyond the disease not spreading or spreading that have to do with our mental health. Over the few weeks and over the weeks that we have been working together, over the last 2 or 3 months when we've been working together, talking about this topic with you, every person who has been commenting has been saying that this pandemic is affecting them in one way or another. For you as a healthcare worker, of course, it's direct because you're the one who's dealing with people. You're the one who's seeing how people are going through the disease. And I am really happy that the KNH team, Dr. Kinuthia, your team, Dr. Kalondu, Dr. Mubao, and the rest of the people, the work that you've been doing is really important, because I don't think there's any other person with a platform like you have that has been disseminating information real time to healthcare workers. And I can tell you for a fact, because of this information you're sharing, you're actually reducing the anxiety of healthcare workers in this country, because they now know what they're dealing with. And this is a thing that I think everybody can learn from. Now, the question of mental health and mental health issues have begun with the uncertainty. We didn't know how long this pandemic is going to last. And then as a country, we did something interesting. We said, okay, maybe if we are locked up for maybe 2 weeks or 3 weeks, this bad dream will disappear and we're not going to have any of this coronavirus here. Woe unto us. We locked down, we opened, people are all in Ushago for some reason. I'm sure even a lot of the people we're talking to today are not doing it from where they normally are. They're probably in Ushago. But then the numbers don't look like they're going down. So mentally, we are now anxious. We are worried. I just did an interview earlier today before I came, where they were asking me, what is the mental health effect of staying at home for children during this pandemic, because now they've been told they're going back to school in January. So I remember, so everybody is now beginning to realize it's not just about whether they're going to sit down and do an exam, whether they're going to complete a class, but it's also about the mental health effects, the depression, the anxiety, the uncertainty, the economic effects, which have now rendered a lot of people jobless and not being able to fend for their families, are also something else we are looking at very closely and saying, how do we mitigate all of these things now? And also in the middle of all of this, we are also seeing something else that's important, that the delivery of services to do with mental health care have to continue. And in fact, we are seeing that there's actually an increased uptake in them. So the first concept we'll talk about, the first thing, is what we call telepsychiatry. And telepsychiatry, of course, I'm a psychologist, so someone can ask me, why am I talking about telepsychiatry? But telepsychiatry is about delivering mental health services, whether they're psychological or psychiatric, using either the phone or internet platforms. Luckily for us, we are seeing that it's actually highly favored during this time because of the requirements on physical distancing. I remember in another platform, we were talking about the use of the word social distancing, and we really are not encouraging people to use the word social distancing, because we're saying we want you to be socially close and to get social support, but it is physical distance that we're asking you to maintain. Maintain physical distance from someone else, but be close to them, have the support that you require, because we're in this, all of us together, and we need all the support that we can get. We're also finding that right now, the ability for the psychiatrist and the mental health service provider to reach more people is better than ever. If you really think about it, if what we have been doing over the last few months is anything to go by, the number of people we've been able to communicate with on mental health, just sensitization alone, let alone even giving true services of treatment, has been really phenomenal and a lot. So we're finding that in the same way, mental health services are now being given to more people, and there's more access to people who never even thought about it before. But in order for us to actually see these things, and if they're working, the issues we need to talk about are the question of access. At the end of the day, for us, it's about access. We don't have enough smartphones, so you can imagine like the Zoom platform that we're using right now, how many Kenyans can actually access Zoom? In as much as we have 90% phone penetration, are those phones smartphones, or are they mulikamuizis? Are they normal phones that don't have a screen that can do video chats, for example? So we're saying that while we might have many phones, maybe the video platform is not available to everybody, but at least we know we can use that and utilize it. Also, how many people have the knowledge of those applications or the apps that actually enhance this video conferencing? Not so many people, and also there's the issue of cost, for example, because if you really think about it, it will require bundles for someone to actually do it. So we are seeing that in Kenya, the question is not whether we have the technology, but it's, do we have access to the technology, and do we have the proper training for people, or at least exposure of people, so that they can actually use them without any difficulty. As it is, even for those of us who've been using the platform for a while now, we are still experiencing our own hiccups from time to time, and we would like to say that even for Kenyans, I'm sure there's that challenge that might be expected to be out there. Now, that's about the Kenyan mwananchi who we are serving, but how about the mental health practitioners themselves? It's an assumption that just because somebody is a professional in their area, that they're also a technical guru, especially when it comes to technology. You find that a lot of healthcare providers don't have the latest gadgets, maybe, or they don't have even that experience with working with some of these platforms. So you find that in mental health, with even the few numbers that we have, we will require that people are given specialized training for them to be able to actually, be able to utilize the technology properly, and for them to actually be able to do their own work on how to maintain things like privacy. And we'll talk about that as we move on. Finally, we have the idea of privacy as a big issue, because our clients, many of them, even if they have a smartphone, maybe it's one smartphone being shared in the home, or maybe they don't have enough gadgets around. So can you imagine having to deal with somebody who's talking about their own distress or talking about what they're going through, and they come from a family where they have to share a device? So the question of privacy also will become a big one, because someone might not want to really disclose what's going on with them when their children are in the background. Maybe they might want to say it when they're alone, but the opportunity to be alone might be few and far between. So you find that that might be an interruption. So what we're saying is maybe we might require to find out, is there a way to introduce the question of privacy so that people can actually disclose whatever is going on with them in a more free manner? And also, let's not forget, children are at home, and in some institutions and some schools, they're doing online learning, and the only gadgets that might be used for that online learning are their parents' gadgets. And so therefore, you find that if the services are being sought during school going times, then there's a problem. And then and therefore the children might be requiring the device. So the parent who requires the services, or even the child themselves might require the service, might be interrupted just due to that small constraint. So the other question out of the four that we've been handling as we're exploring this topic is a question of digital prescriptions. For the longest time ever, Kenya has seemed to be a very manual and analog country when it comes to prescriptions, especially when it comes to any kind of medication that requires to be prescribed. So you find long queues at pharmacies, long queues at like referral hospitals. But we're saying that, could this be an opportunity for us to create an infrastructure that will allow for online generated medication? And in fact, this is funny because to me, I think that healthcare should be one of the most technologically advanced fields, because if you look at the area of construction, for example, I was talking to a friend of mine who's trying to put up a structure, and they were telling me that now they have to register their plans, and they have to register whatever they're doing online with the National Construction Authority. And I said to myself, my goodness, if you're doing that, even with driving licenses, we're applying for things online, and even passports, how about medicine? Can we think about something with some measure of security that can help people access prescriptions online, but then have them to be dispensed or delivered remotely? So we think we need to really think about our healthcare delivery system, especially when it comes to medication that are really needed in remote areas. It was not so developed before the pandemic. We're hoping that the pandemic will help us to create that platform for us to be able to do it. If we can, then I think we'll actually benefit as a country more than losing. Also, on top of that, we found that regulatory bodies do not have guidelines for such activities. They don't have really what the explicit formula to follow is. And that's why if you go with a WhatsApp prescription to a pharmacy, sometimes it might be, the pharmacist will be confused on what to do with it many times. And they'll say, okay, I'm not sure if it's authentic, I don't know. And so the regulatory bodies also need to step up and come and fill in the gap and say, what do we do with digital platforms? Okay. There's also the question about charging the services that are being offered. I think the biggest question that mental health providers are wondering is, if my consultation fee was X before the pandemic, and I was going to an office which I was paying rent in, it was brick and mortar, was the price that I was charging, was it only about me being able to take care of my other bills, or was it just my professional fee? So what is happening now, there's a question of where you're operating from. If you're operating from home, people don't seem to respect that space as they were respecting your office. So there's also a big question amongst the community of, how do you charge for these services? I can tell you for a fact, with the psychologists that I work with, that has been one of the biggest consultation questions I've been asked by colleagues and people who I mentor, who have been asking me. They've been saying, Doc, we don't know what to charge. Before we were charging X, but now what do we do when you tell the client that? They say, but sini kuongea tu. And they start wondering, what should they really charge because of that constraint. Of all of these considerations, I think the regulatory bodies and professional bodies also have to come together. I know for a fact, right now as we speak, the Ministry of Health is really working on something in conjunction with our associations and the Mental Health Psychosocial Support Subcommittee of the National Emergency Response Committee, where they've asked us to come up with telehealth guidelines to actually guide the country on what we require. What I'm happy to say is that, especially as counselors and psychologists, we've really been coming together and saying, what are the ethics around it? What do we need to do? And how can, and therefore, once we advise the Ministry of Health, then they'll put out those kind of guidelines as a place to begin during the pandemic, and hopefully beyond the pandemic, we'll adopt them as the way we do business moving forward. I'll also be seeing today, I'm doing a single screen setup, so I'll not look at the questions first, but I know that we'll be monitoring them as we move along. Of course, in the area of psychotherapy and counseling, what have we seen so far? We've seen that right now, because the embracing of therapy and counseling has not been really high, had not even been really that high before the pandemic. This is something interesting that we've observed, that the pandemic has brought almost a need for it. It has been improving, but then it has not been really up to par. But the funny thing is that the pandemic has brought so much anxiety, so much stress and depression that people are now saying, who do I talk to? So what has happened is that psychologists have been promoted from, and counselors from, not seeing clients to almost seeing more clients than they can actually be able to manage because of the pandemic. So what we've been trying to do is to say, can we balance the way psychologists handle this and how counselors also handle this? Can they also have an infrastructure like the one I was talking about earlier, of like this Zoom platform or other secure platforms to be able to provide video therapy? And it's because we also know that if psychotherapy is delivered properly, it can actually allay the need for dispensing some medications. For instance, if we're talking about mild anxiety and mild depression, studies have shown that really pharmacological intervention is not the first place you can go, but with good, real good therapy, psychotherapies like cognitive behavioral therapy and the such, you can actually be able to help the clients like that. So we're saying that this is the time when psychology and counseling might actually start shining as good partners and equal partners in the management and treatment of mental health issues, as opposed to the far distant cousin who nobody really wants to welcome in. And also on top of that, we know that there's issue of regulations that are regulating the profession that have actually plagued us. But once that happens, I believe strongly that we'll be able to deliver our services really well. The other thing that has happened with regards to psychotherapy and counseling is that there's a lot of hotlines now. We know the 719 from the Ministry of Health. We know 119. 1199 from Red Cross. We know of the other one that just was raised by KMA the other day. And now we are seeing that crisis hotlines are being utilized to kind of help people work remotely on whatever they're going through. And for me, even if they're not really video enabled for majority of them, the fact that they have voice capacity is really good for us as a starting point, especially in averting crisis. Like you can imagine, like the cases we've been hearing, the gentleman who threw himself from the Nyali bridge just the other day. And I was asking myself, my goodness, if we had a way of reaching someone like that even before, and even in the middle. And what is really sad was, as he was going off the rails, and even as he was actually getting really upset, what the people were doing was just recording him instead of working with him and really trying to calm him down. They were just saying, why are you carrying a panga? I'm going to record you, I'm going to report you to the police, as opposed to try to calm him down. So I think sometimes even as a country, we need to be told what are some of these signs and symptoms of somebody who's distressed, and how do you calm them down to be able to get them help like they require. Also, we saw that a community approach to health services will also ensure that teletherapy and counseling are embedded in health service provision. What I've actually seen is that you cannot start deploying counseling or psychotherapy without involving a community. My friends, I can tell you that maybe in urban centers you can try to do that, but in rural communities, what is this thing that you're going to do talking to someone's husband, wife, or their child alone? Who are you and why are you coming to tell them? Because for them, the Kiswahili word that has been used to describe counseling is ushauri, but it's actually more related to law, which is advice or legal advice, more than more than really counseling as per se, but that's a Swahili word. So the idea is that if I'm going to get advice from anybody, it has to be somebody that has been vetted by the community. So what I'm saying is that sensitizing communities, having them know what the value of counseling and psychotherapy is, and also having people who are champions from those same communities to do it. We have a lot of community health volunteers. We also have other people who are in the grassroots, maybe Nyumba Kumi people, who can also help for us to really advance this agenda properly. Also, with regards to psychotherapy and counseling, there are the questions of ethical considerations, confidentiality. Where are you giving the service from? For example, are you in your sitting room with your child running around in the background, and then someone is seeing who is distressed, someone is crying on the other side, then your child is saying, Mami, mbono huyo mtu analia, and what's going on? So we have to also be very careful, and we've been really seeing that we have to build our infrastructure to also account for both confidentiality and privacy. But the one I want to really talk about, my friends, is competence. Competence. There is nothing, you can have the best platform on earth, you can have the best bundles or internet connection, you can have all the phone, but if you are not competent, you might actually be increasing the harm in the person's life than helping them out. So we found that the need for competence, assuring competence in delivering services is really key. Now, luckily for people who are in the medical profession and for healthcare workers, majority of you have boards and you have regulatory bodies, but unfortunately for counseling and psychology, the board has not yet been put up, but this is something that I think is going to be in process very soon. So that is what is going to guard the competence question that we're talking about, because you have people go for a revival meeting over a weekend, they come back, all of a sudden they're a counselor. The other one says they're specialized in children. Another one comes and says that they're specialized. A lot of these things you see. And now to make matters worse, my friends, the fact that now anybody can be on Zoom and anybody can make a poster is even worse, because now I'll put a really nice, pretty poster and put over there and I say, child therapist with 20 years experience. How do you know? And there's no way you can actually search this person online to see, are they competent? Are they licensed? Are they giving these services for, from a legally protected perspective? And I think this is the next generation for us. We are seeing that those gaps are going to be filled very quickly, because once we see it's being deployed a lot, the competence of our providers will also have to be measured against that. All right, the next one, and the last one that I want to talk about is the question of preventive as well as promotive mental health. We're saying that it is crucial that emphasis be put on both preventive as well as promotive mental health interventions during and after the pandemic. When we're working on the task force report, we're going around the whole country, we realized that the investment we would require per capita for people is so small, honestly, that if we actually were to spend 150 shillings per Kenyan per capita to just promote mental health and to treat mental health in this country, we'll actually have less of the cases we see every day in the newspapers, and everybody will have access to quality and good mental health care. So the idea for us is to say, can we focus a bit on the preventive and promotive mental health than trying to wait to cure things when they've gone already too far, and when somebody really requires pharmacological intervention, inpatient intervention, or even chronic intervention, which is what the worst outcome sometimes can be for some of these interventions. As I've said, it's cheaper on our economy and our families. There's a time I was talking about the cost of rehabs in this country. I don't know how many of you know, but one of the cheapest places you can go for a rehab, for rehab services, inpatient, charges about 150 or 160,000 for 3 months. Can you imagine? That number to me is immoral, especially considering that we have more Kenyans than not who live less than $2 a day, more than 200 bob a day. So why is a person like that supposed to be getting 160,000 for 3 months? It's not tenable, it's not possible, it's not even sustainable for our economy. Also, we know that for us to prevent Kenyans from slipping into mental anguish and developing mental health issues, there are other systemic things that need to be addressed. For instance, the economy. And right now, I can tell you, I don't think there's any week like this one in the whole pandemic in the history of Kenya because everybody has a theory of what the president will say. Like right now, there's 10 theories I've already heard. Atafunga, total lockdown, hamtaenda mahali, kila mtu akae kwenye yako, ebu kuja Nairobi kabla ufungiwe kule huko. So everybody is talking about what he's going to do. And if you really think about it, is that, okay, fine, let's assume we have what is called a total lockdown. Do we have a contingency plan of what we're going to do with Kenyans who will not be able to move freely if that was to happen, for instance? And what do we do with them to do with the economy? That's why you hear in some places, like I was talking about when we're talking about behavior change, there are people who told me, in fact, the other day I was in a place in Kiambu, and they told me, wele, nyinyi endeleni kuongea kizungu mingi. Sisi, afadhali tupate corona, na tusikakufe njaa. So when you start hearing someone saying that, the reality then says that if we don't look at the systemic questions of feeding our people, giving them opportunities that will actually give them. And I saw a tweet, in fact, the tweet that I saw that made me understand what Kenyans are saying. Kenyan said, after someone had gone online and spoke to Kenyan men and how Kenyan men don't shower, I won't say who it is because they might now turn against me. But the idea is that someone said, matatu drivers can't drive over Zoom. They said that watu wa mjengo, they can't build over WhatsApp. And they said that there are people who are in an economy that does not understand what you're talking about in terms of working remotely. And we have to really safeguard the Kenyan who does not have his living act from an online platform or from a remote kind of a way of doing it. So I think these are some of the discussions we really have to go deeper in and really ask ourselves, is there a possibility of a better outcome for that? We were also suggesting that to be able to do this, Nyumba Kumi is a natural place to start. Nyumba Kumi people, everybody knows each other. It's easy to talk about what are the risk factors for each family. We can have a really good database set up that will tell us what are the risk factors per place where we are. And then we can intervene for those risk factors based on where the people are found. Also, we saw that the media is very key in what they actually promote, and it would be really, really important for the media to be actively involved in promoting positive mental health, running public service announcements, putting people telling us what to do and how to live, and giving us hope. I'm happy that I've been seeing some people have been doing some really good positive adverts saying, look, this is only going to be for a season, we'll be okay, and everything is going to work out. I really like that kind of stuff because it kind of makes people's anxiety go lower a bit so we can be able to work with them from a better perspective. Also, it's time we started identifying mental health ambassadors who will be the ones who talk about mental health needs and requirements from community to community. They're the ones who are going to tell us, what are their challenges wherever they are. And so for me, I think, when you look at these people who are called influencers, for example, for the youth, it depends because, of course, I also think that not everybody is an influencer, or just, some people just think because they have Twitter, they can be an influencer. But the idea is, who is an opinion shaper? Who is an opinion leader? Who do we listen to? Is it a religious leader? Is it somebody in our community? Is it someone in our workplace? So let us have those ambassadors who will actually be promoting positive mental health and positive habits for better mental health and coping skills, like we've talked about severally on this platform. Also, we are saying that we need a huge dose of creativity, which Kenyans do not lack, by the way. We've seen a lot of good skits and a lot of like arts coming up, music, things that are actually helping us to kind of cope with what is going on with us right now, and kind of helping our mental health to actually be a bit more stable and a bit better and preventive. I'm so happy because I've seen Kenyans are now starting to be very positive when they talk about the pandemic. In the beginning, people were a bit hopeless and they were talking really negatively, but now people are starting to say we're with it to stay. That's a really powerful place to begin from, because it means if you have to stay with the pandemic for a while, it also means that we need to know then how do we live and coexist with the pandemic to be able to avert whatever issues might be there. As I end a bit, the real issue here is about accessing mental health services and interventions for our people. We are talking about accessing them before they're required, during the time when in a crisis, and even after, for aftercare. So the question becomes, can we create a Kenya during and post-COVID that will actually be so clear in how we access our mental health services. And it's interesting that it has taken a pandemic to do this, but I think there's no opportunity that we can lose if we can actually do something good for this country by saying, okay, no problem, you might have some mental distress right now. What is a platform that you can use to actually access the care? Who will guide you all the way from the community, the local community, going up to the sub-counties, to the counties, and then all the way here to the national level, where we can have a discussion. Maybe if we need, admissions that require specialized care, we can do that. But I think all through our levels of care, level 1, 2, clinics, the level 4 and 5 referral hospitals, we can talk about how do we then divide the labor to be able to deal with all these mental health issues that are there. I think that after this pandemic is over, we need to insist that the infrastructural developments to remain in place. Not that we put up, it's not like a tent. You put up a tent only when you're doing a graduation party. Then after the party is over, you disassemble it. We're saying that, can we have these developments still in place just to be able to deliver the services well? And then afterwards, we can actually continue using those kind of infrastructure systems that we'll have put in place. For me, I think it's a good thing for this country, and especially when the topic of mental health has become a really big one, we need to really follow it up closer. Also, I think it's my really big view, and people have accused me, I've been accused of being an optimist, but I think that the pandemic will really strengthen our mental health system in our country. And I think that's a good thing for us. So if there's something that can come out of this bad season that we're in of a pandemic, if our mental health system will be better, then I guess that's one of the positives we can actually reap from it. Also, we are hoping that we can evaluate how we perform during this time so that whatever improvements we need to make, we can actually start improving on them so that we don't make mistakes moving forward, very well knowing that we have a chance to really make our system much better and serve our people much, much better. Also, I'm talking about training of mental health practitioners. It is time that we scale up HR, the human resource requirement in mental health. I know that there's the stigma that Professor Twali was talking about last week, and he talked about the self-stigma, which anybody who has ever gone into mental health can talk to you about and tell you. But now the stigma seems to start, it's reducing now, and people think it's actually a good thing to do. Even after they've studied other things, now they're going to mental health fields, be it counseling, be it psychology, be it marital and family therapy, be it other specializations that will actually help them to move the agenda of mental health care forward. So I think that we need to train them, and we also need to include aspects that we have gotten from this pandemic in our trainings. For instance, how do you use Zoom for intervention? How do you use video platforms? How do you use audio functions, like, for example, phone therapy and all of that? While it might be taught in many universities and colleges and even in tertiary institutions, the problem is that nobody really spends time with it because nobody had ever seen what it might look like having telepsychology or teletherapy or telemental health being the only, if I can say it, the only option. So I think for us, being able to get the training properly, making sure we look at the ethical questions and addressing them before we go to the field is really, really key for us to be successful. Again, I know I always say this every week, your work is very priceless and you are appreciated immensely. As I've always said, we have a team ready to work with you. These talks we're in with a few of people, so we can actually have regular meetings with them, so we can actually start doing interventions, because we know that there are people who are getting stressed right now, and we are ready to work with you to actually support the work that you've already been doing. Keep up the good work that you've been doing. And as I've always said, every time when I sign off, I say that after all is said and done, you are and you will still be the heroes of this pandemic. Thank you so much for this opportunity and for this chance to talk with you. And thank you for the work you're doing for this country. Thank you.
Thank you very much, Dr. Oscar Githua, for that presentation. We truly appreciate that you always find time to come to talk to us. We don't take that for granted. I'm seeing a few questions in the Q&A section, but before we go to that, mental health is a process. It's not like the way you get a cold and you're prescribed for a few medication and you get well. It is a journey that is not that short. Sometimes it takes years to recover. Sometimes it takes months. It varies with every patient. So as you have given us very good suggestions on how to handle mental health issues, one of them being telepsychiatry. I don't know whether it has been tried out in other areas and how successful or effective it has been, especially when it comes to assessment of the patient. Because when you're doing a mental state exam evaluation, if you're doing it over the phone or over internet, you expect the patient to be able to be openly vulnerable, to have trust in you, to actually be very honest and candid about what they're going through, to have a conversation that they're not ashamed about. So as these suggestions were brought about by the task force, how effective are they, especially the telepsychiatry, which is a low-hanging fruit which can easily be achieved? How effective is it?
Thank you so much, Doc, for that question. And I think you've hit it right at the heart of the question, especially if you're talking about assessing patients, starting with a mental status exam. It really becomes a challenge if you cannot be able to see the client properly, if you cannot see their, these nuances that we look at with clients when we're looking at how they're operating holistically. And to make a proper assessment, you really would want to have a good picture of them, how they're presenting, how they're talking to you, and the kind of things they're saying. So it's not only just about content, it's also about the context with which they're presenting. So you're right. I think one of the things we must address is to say, then maybe if it's not just the individual providers having their platforms, but can we say, for instance, if every like hospital that is available can have a platform which is like a video enabled platform, and then maybe they have someone in the ground like the community health volunteers who also have a system that matches theirs. Is there a way they can communicate and see the client in a holistic kind of a manner? Can they work together? And the example I want to draw your attention to is what I've seen with doctors from Israel. There used to be an office in Nairobi, somewhere in the city, where people used to go for consultations. And what caught my eye back in the day was that the doctor was in Tel Aviv, and from Tel Aviv, he could actually work in conjunction with a nurse or with another clinical officer on this end. And then they'd tell them, okay, examine this patient, okay, touch here, touch there. What do you feel? What do you see? And that collaboration yielded really good results. Were they the best? I am not sure. I don't know. But I would say that if we were to say creatively, can we find a way to make sure that we have terminals which are able to dispense this kind of deploy this kind of video conferencing we're talking about? As a task force, our biggest concern is about access. We are saying that we want all Kenyans to have quality mental health care, no matter where they are, be you in Marsabit, be you in Lamu, in Kisii, in Turkana, wherever it is in this country that you are, we want you to be able to access that kind of healthcare. But when we talk about telehealth, which you've really raised, I think for me, it's about agreeing, and that's why we talked about regulatory bodies. Are there platforms that we can have, even as a country? It's time for us to even innovate. All these young people from the Silicon Savannah who are starting startups which disappear after 3 months, maybe this is the time to actually start doing something that is sustainable for the country. Have a health product, something that can be given to the country. We can actually support their really good creativity, and maybe they can actually help us to address our issues. So I think there are many ways we can go with it, but you're really right in asking about, how can we, how does the task force look at it? For us, it's about access, and if we can be able to do it using creative ways, the better for all of us. Thanks, Doc.
Thank you so much for that response, Dr. Gideon. And I agree with you. It's about time we started getting the young people to innovate, not just the young, anyone who has an idea, put your creativity on paper, develop something, develop a draft. Let us have a look at it. Let's see. I really hope at one point before the end of the year, we'll be able to have a session on ICT innovations in health, especially the new startups. So if you have any startup and you're in this forum, please reach out to us so that we can also let people know what you have out there, and especially some of the resourceful platforms that I've seen. Now,
Yes.
you talked about the issue of digital prescriptions. I'd love to hear from the pharmacist and the pharmaceutical technologist in the group.
Yes.
What do you think about digital prescriptions? We don't have any regulations or guidelines, as Dr. Gizu has clearly mentioned, but kindly just share with us your sentiments. What do you think about it? Is it possible? And how best can we approach it? You also brought out issues of psychotherapy and counseling. There's an increase in demand for counseling, which is a very good thing, And I'm very excited to see the crisis hotline numbers coming up, and people, there's a lot of uptake in that service, and also the community approach. You talked about preventive and promotive mental health issues, and you brought up very clearly issues of influencers and mental health ambassadors. I truly agree with you on that point. The only thing that probably we need to work on more is the media, so that people don't feel like they're struggling alone. Sometimes when you don't see it being talked about so much out there, you might think you're the only one who's struggling with it alone.
Correct. Yeah.
But when you hear the other people also struggling with the same issue, then you get encouraged to take up the services. But thank you so much for that. Now we go to the Q&A section, and we'll start with just the first one. When somebody is asking, how can we help our friends deal with anxiety during this period? I know it's not related to what you're talking about, but we'll just try and address every mental health concern that is coming up today. Yes.
Well, thank you, Dr. Kalondu. I'd seen that question from the participant, and I really thought it's a very important question. And the way I'm going to approach it is by saying that from the anonymous attendee, that how can we help our friends not only deal with anxiety during this period, but to deal with any mental health issues, okay? I think to just cover everything, because anxiety is only one of the very many. I think there is a course and there is something that we've been trying to teach healthcare workers a skill, which is called psychological first aid. The thing about psychological first aid is that it gives the chance for people to be able to respond to the person who's in distress in a human kind of a manner, but then also in a professional way to be able to recognize if things are beyond helping from a friend, for instance. So for me, what I would actually like to say is this, is that if you are on this platform, I know that many of you have been coming week in, week out. There are the sessions which have been organized for Tuesdays and Thursdays, and Dr. Kinuthia can speak to that probably, or Dr. Kalondu, anyone can speak to that. And there are sessions for psychological first aid in two ways. Number one, learning the skill, but number two, also going through it yourself. So I think one of the places we must organize is to say, if we have each and every healthcare worker in this country, and especially the ones registered on this platform to be trained in psychological first aid, we'll be doing this country a huge favor. And we'll be doing ourselves a big favor, because we'll have a tool that does not require you to go to university for 3 years to be able to deploy, but actually it's just some skills that you can actually have in your hand with a couple of hours of training and reinforcement, especially because you work with people already, to be able to help them. The idea is to just be there for your friend. And I also want to say something. That sentence also had the word friend in it, Dr. Kalondu. So I want to also ask my colleagues that when you're working with your friend, it's different from when you're working with a patient. And it's a huge thing that I think I must say as a psychologist myself. Even for me, no matter how many years I've done in psychology, if it's a friend of mine and he's come to me as a friend, trust me, I will be working with him or her as a friend, not as a patient. The same things you do with a patient, the kind of assessments and all of that, you don't do that with a friend, because a friend just wants your social support. The other best thing you could do, if it is not a level of anxiety that is manageable through you giving social support, is making appropriate referrals. It's really key to not be the one who owns that anxiety. Because what ends up happening is that, your friend is in problems, then you decide, no, I must make sure this person is cured, and that they are the ones who, if you do that to yourself, what ends up happening is that you burden yourself without really knowing the proper history, without really knowing what are the circumstances around them at the moment. Then you burden yourself, and then you find that you're now making your work suffer as opposed to help them properly. When a friend reaches out to you, even if you're a doctor, CEO, nurse, or whoever it is, let me tell you, they're not coming to you because you're a doctor. They're coming to you because you're their friend. And I think that is the one thing that we all must know. Even for me, a lot of people will come and say, oh, doc, what do you think about A, B, C, D? I answer as a friend. And then I tell them, if you really need professional advice, especially professional help, I make the appropriate referral, because you will be entangled and you'll not be able to help them out with that issue. But halfway through the issue, you'll also get angry yourself and anxious and wondering. So then you won't be helpful. So the idea is to support your friend as a friend, but then refer them for professional services using all the avenues that we now know are available to us. Thank you.
Thank you so much, Dr. Guido, for that elaborate explanation. And I agree with you. We should support our friend as a friend, and they're not coming to us as a healthcare provider.
True.
Thank you. Thank you for that. Ombiro is asking about how we can deal with irrational drug use, and not just drug. Let's also talk about alcohol use, because we see now the Ministry of Health has decided to shut down everything, no more alcohol, because probably people, the uptake or the intake is more than they had anticipated. So he's asking, with telemedicine, where people easily camouflage, how do we deal with irrational drug use or poison or any substance abuse? How do we address such issues?
Good. You know, this one is a question about the chicken and the egg. Yeah? So what has happened is, before March came, Kenyans, of course, had a high rate of using alcohol for recreation and even other drugs. But then now when the pandemic came, the anxiety that was natural in everybody increased. And the first place people go to cope with anxiety is using substances. So you find that the drug use and the alcohol intake went up as soon as the pandemic began, which was a function mostly of the anxiety around the pandemic. Now, the problem is that that has been since March. If you think about the months that have passed now, April, May, June, July, 4 months, we're now saying that people are getting into really deep trouble about substance use, and probably some dependence starting to crop up. And for me, I think we've talked about this before. One of the worst consequences has been the domestic violence that we're seeing, and intimate partner violence that we're seeing, which has been plaguing our people. So for me, I'd want to say, what do you do? It's really hard to tell by looking at the client just on their face, but it's hoping that you can have a good rapport. You can have good rapport with your client, for them to disclose what's going on in their life, and tell you exactly why they're using what they're using, how that's happening. So for me, what I would say is to say, we cannot stop people from drinking irrationally. We cannot stop them. We cannot, stop them from masking it from us. But at the end of the day, just being open to help them and being non-judgmental is really helpful, to help them to just realize that whatever is happening to them is not what should be happening. Now, on the question of what is looking like might be a total shutdown on the sale of alcohol, I also have a comment about it, and we don't need to imagine what could happen. If we look at just two countries, case studies, the first country is India, the second country is South Africa. I hope that the people who are making policies and are working around this question are observing those two countries very closely. When they went into total lockdowns, because these two countries had what is called a total lockdown, what ended up happening was that people were not allowed to buy alcohol. They were not supposed to even take it during that time. But when they got out of lockdown, what happened? The lines that were outside liquor stores and bars and clubs and everything were unbelievable, because nobody could stay without having a drink. So what ended up happening was they ended up having a higher prevalence of use afterwards. And the violence that has been seen in South Africa is unlike any other violence I've seen in a very long time. So I think we need to really be cautious, at the same time wondering, will closing down and shutting down the use of alcohol completely be what helps us? It will help us in the interim when people are not using. But after you open it up, because of course they want to do that indefinitely, then what will happen? Will Kenyans go and start using now ridiculously? Will now everybody become an addict after that because they missed alcohol for 3 months? Or what will it be? I can't claim to have the answer, Doc, but honestly speaking, what I've seen is that it seems to be causing more harm than good. If you lock down people from drinking the alcohol, then open it up later. When you do that, people seem to overindulge. Even the ones who are not drinking a lot end up drinking way more than they could ever have drunk. And so you end up finding yourself in a problem. So I don't know, not that I have the answer, but I think we need to ask ourselves those questions and really process them and say, where do we stand, and can we create an impact to actually not have people really endangered, their lives endangered after such a lockdown is ended? Thanks.
Thank you. Thank you for that response. Um, all right. There's a question from Dr. Wilberforce Kabweru, all the way from Uganda, Mulago, and he's sending
Oh,
you
wow.
greetings.
Good.
And he's asking you, what has been your experience in provision of acute mental psychiatric services, especially in the case treatment units, quarantine centers, and the community, especially before, during, and after discharge? How have you managed, and what are some of the recommendations, especially to patients who've lost their relatives, employment, or property? Then his second question is, what are the challenges that you faced in providing psychotherapy to patients with chronic mental illness and COVID-19 infections in terms of compliance? And I'm presuming that's compliance to psychotherapy.
Of course, of course.
Okay. Yeah.
Okay. Doc, first of all, I don't want to be the only expert who can answer. If there's anybody else on the panel who can answer, please allow them to do that also and contribute. But I'll give my limited experience as well to be able to help Dr. Kabweru. Daktari Ogambachi, that's the only that's the only thing I can say from our neighbors for now. But I think that psychiatric mental health services during the time of COVID suffered a bit of a hit, and that was what we saw. Maybe it has changed now, but if you look at the months of March and April, the admissions, in fact, some places were not admitting new patients because they did not know what to be expected or what the cause the disease, the COVID-19 infections were going to take. So what we saw was a lower uptake of the services. And so therefore people were being turned away or they're not being admitted because the hospitals themselves were operating on fewer staff, and they were operating on what you'd call like shifts, which were less less accommodative of having more patients. And as you can imagine, some of those units did not have any social distancing protocols in place. So it was not going to be feasible as well to have patients being inpatients in that kind of a situation. So what we found was that the uptake was lower, but at least people were able to get their services and then leave. Mostly what I saw was in terms of getting outpatient treatment and leaving, then being given to do management somewhere else. Now, the question of psychotherapy, I have not had personal experience unless someone else has gotten personal experience of working with somebody who has a mental illness as well as the same time comorbid COVID-19, especially with compliance. But what I can say is that depending on the kind of mental illness you're working with, of course, and the level of mental illness, I won't even speak about them being infected with COVID-19. I'll talk about just any compliance for that matter. If you're talking about social distancing or washing hands or stuff like that, I think it's only working for people who might have OCD and they probably are happy about washing hands all the time. Now they're being validated and being told, you know what? Yeah, there's germs that can kill people. The irrational thought that had been there before has now been confirmed as true because COVID is killing people, and it's actually a germ that we're actually avoiding. However, if you have people who are paranoid for one reason or another, telling somebody paranoid to wear a mask, or if you approach them and you're wearing a mask, might actually be a bit catastrophic for your relationship. So I think it might be handled case by case, and especially because we cannot treat clients as diagnosis. We have to deal with them as individuals, because the way schizophrenia, for instance, can present in one person will not be the same way it presents in another person. So we have to say that maybe it's challenging because even understanding what is happening, you can imagine if somebody had delusions that there was a new world order that's controlling people and wants to kill people, now you have a problem because you're not going to convince them it's not true. They'll tell you, but where did COVID come from? And nobody can tell you where it came from. You start talking about Wuhan, they tell you, oh, that's a story they've told you, it's conspiracy theories. And so it's really tough. It's challenging, Doc, for us to work with people who are mentally ill. But the beauty of it for us is that the reality checking for us does not consist of just checking facts, from encyclopedias. It's also about the relationship we have with our patients. to say, do they trust what we're saying, or is it just something we're saying for them so they can just take medication? So for me, what I'd say is that reality checking for me is more about relationship than just, proving whether it's true or not. Thank you so much.
Thank you. Before we continue with this, I wanted to just ask you, with regards to the psychotherapy and counseling, did the task force recommend anything or any services to be provided to the families, especially after burial? Because we've changed the way we are burying our relatives, our loved ones.
Yes.
It's a bit traumatizing than
Absolutely.
before.
Yeah.
There's no that community feeling that we used to get, where people come and mourn with you. Right now, it's two days, you're done.
Okay.
Within 15 minutes, you bury it. So are there any services that the task force might have recommended, and how can people get through, if there's a hotline number for continued closure? Yeah. Yes, thank you.
So I think right now, okay, let me. I think I mentioned the task force, but that was mostly in passing. But the correct people who would be dealing with something like this is the mental health and psychosocial support subcommittee of the National Emergency Response Committee that's dealing with COVID in the country. So what we've been doing, in fact, as recently as today, we are still developing those guidelines, the telehealth guidelines, and how to provide those services. But we've also been having discussions about the way grief is one of the biggest issues we're dealing with as a country right now. And our grief is not just limited to the people we are losing, sadly. It's also about the jobs that people are losing. It's also about the livelihoods that people are losing. It's also about the freedoms that people are losing. It's about the friends people are losing. It's more of a, it's a classic, it's less of a classic grief, but it's more of a general grief. And we're finding that we need to be working with people more about this grief. And then now comes complicated grief, because then you have someone who falls sick on a Tuesday, then by Thursday they sadly don't make it. By Friday they have to be buried. So you can imagine, on Monday this person was okay, but on Friday they're buried. Even culturally, there's an issue. That's why the discussion for next week will be a big discussion, especially about our culture and religious beliefs and spirituality. And for me, I think that what we can do is, even as we move on, we are learning still. The recommendations about working on grief should also be very clear, that we're not dealing with a normal kind of a grief. It's not a common day in Kenya where you're told, forget, move on, get over it. It's not really that, because this is a strange disease that has come. It's taking our people in a strange way, and people are really hurt by it. And so the people who are working on the ground as psychologists or other mental health providers are really, for me, I think we really have a long way to go to really make it an equal experience for people to deal with grief. And also, don't forget that grief therapy or even grief interventions are not just one-sided. There's also a cultural component to it. The way you'd actually be dealing with somebody who comes from a culture that has hope after death is different from the way you talk about someone who comes from a culture which does not have any hope after death. So those are the things that we have to consider, even as we work with this counseling or psychology and psychotherapy, especially when we're handling grief. But it's a huge deal. And I think as a country, we're now mourning. Every day you see the president, you see other people sending tweets out to console people who have lost relatives during this time. And it's not becoming real. Before, it used to be, we didn't know anybody who had died from COVID. But now, people are quite giving the stories, and they're starting to share those stories on social media. We're starting to see them, and the effect of this grief is really a lot. So I think for now, that's where I can begin, and we can see how we can address that moving forward as a team.
Thank you for that. Let me just sample a few of the questions, or a few of the feedback from the pharmacists in the group. Douglas is saying he thinks digital prescriptions can work. Tony Kiraide is saying is failing on digital prescriptions is, if we have to embrace it, it calls up for teamwork and the prescriber's mobile number on the presentation. But it's really hard on them currently. It's very hard to issue a digital prescription or to issue the medication to the patient. Then somebody's saying the prescriptions are regulated by CAP 244, which currently does not recognize digital prescriptions. There's also from Cletus Otieno, he's saying digital prescription is prone to abuse and hence requires proper regulation and guidelines. And that's what those are the sentiments you echoed when you're taking us through the digital prescription
Yes.
session or topic. And that's food for thought for all of us in this platform. How best, if there's a innovative nature or streak in you, please find out best to be able to develop a system that actually is able to address the patient concern, the system concern, that's the regulatory bodies, and cannot be abused, or even if it can be abused, very minimal abuse, and is also a very safe platform in terms of privacy and confidentiality of the patient's information and the medication that they are getting from you. So that will be a very good innovation to see from one of the healthcare providers.
Absolutely. Yeah.
Yes. Now, Joyce Ngugi is asking whether you developed any roadmap or timelines for the national teleguidelines. And she's also suggesting if we can use the term telehealth instead of telepsychiatry.
I know. Yes,
Yes.
I've seen it. Yes, absolutely.
Yes.
So on the first one about so it's not so I'm going to repeat. It's not the task force that's been doing the guidelines, because the task force mandate ended the moment we submitted the report, but it's actually the mental health and psychosocial support subcommittee that has been dealing with COVID right now. So the timelines within ourselves intra-group were this week. So we're going to be having those guidelines up and running this week. But then to the country, that is up to the Ministry of Health, because they're the ones who have to publish them in the same way we've actually been doing over time since the pandemic started. A lot of the guidelines that have been issued by the Ministry of Health have been done according to their policies and the way they normally have things posted and broadcasted to Kenyans. So I think that will be for them. So I'm actually hopeful probably in the next 1 or 2 weeks maximum we'll have those guidelines. The other thing to consider, excuse me, is the fact that when the pandemic started, I don't think people knew how long it would last or how long it would stay with people. So even what the focus was, or even what the priorities had been in the beginning, were very different from what they are right now. So what we are seeing is that the more we settle into the pandemic, the more people are now able to prioritize what are the issues that need to be handled immediately, what are the ones that need to be handled in the midterm, and what are the ones for the long term. Like I said, even in terms of like having it be a permanent thing moving forward. I think it's good for our country. So we are taking our time, just because with something as serious as what we're going through right now, we don't want to get off the blocks the wrong way. So the question about the comment about telehealth as opposed to telepsychiatry, I think at the beginning of the presentation, I made it clear that the lead author of this part of our 3-part paper was Dr. Lynette Ongeri, who's a psychiatrist. She works for Cambridge and she's a lead researcher there. And we, in the paper that she was submitting, there was a part of telepsychiatry, because we're talking about mental health services and telehealth during the time of COVID. So it was a subtopic. So we cannot have a topic of telehealth, because now you have to put in other things which are not part of the paper that was being written. So it was not being written because of lack of recognition of its specificity, but it was written because of that very same reason. We wanted to be specific about what we're talking about, and what was being talked about at that point was telepsychiatry. And then, of course, we've talked also about counseling and psychology, as I mentioned, and also other aspects. So that was very deliberate, because for us to really anchor our mental health services in whatever we're talking about, we have to be clear about what we're actually talking about. So she was talking from her experience as a psychiatrist, and also for the fraternity of psychiatrists who've been finding it difficult, according to those discussion points that I made. But to your point, the question now is not just about telepsychology or teletherapy. It's even bigger than that. It's telehealth generally as an area. So we as healthcare people and providers are now talking about telehealth as a bigger issue. So thank you so much, Joyce, for your question, and good to see you on as well.
Thank you. Another view from Nado, my Indian, I like this one. It's saying, in my view on matters digital prescriptions, it will be easy if digital infrastructure is developed in conjunction with the PPB, and say a prescription is accompanied with a code that can be validated via the PPB portal and expires once dispensed. It would be easier to know the prescriber, the dispenser, and the dispensing outlet. Thank
Doc,
you.
can I say something?
Yes,
You see, as I've already had, me, I'm hearing ideas. That's a business already.
exactly. It
So if
is.
you and I we partner with that person, we are millionaires. That's great. No, I mean, to me, this is exciting. Because we have the solutions amongst us. We don't need to go to Ukraine or Russia to get
Mm,
some scientists to come and tell us what we can do in Kenya. The
that's true.
practitioners themselves are the ones who have the creativity, because you're the ones who know how you use the prescriptions or how they're generated, isn't it?
Mm,
Yeah.
that's true. That's true. We really don't have to go and purchase HMI systems from India. We can develop them here, and they'll be tailor-made to our specifications, which is good. Uh,
Mm.
Earlier on, before we started, you said you're from a discussion about children, and I'm seeing a question about children.
Yes.
And somebody is asking, how do we support children in this season? They're really stressed. They can't play with their friends. They're spending too
Mm.
much time indoor.
Mm.
Please advise us, parents. Now, I've seen some parents taking this approach a bit differently.
Mhm.
Some have actually taken it as an opportunity to create a habit in their children, a culture of washing hands and just being very keen on their hand hygiene.
Yes.
And they've decided to let their children play and just enjoy their childhood. You can
Yes.
imagine locking up your child from March. It's now 4 5 months down the line, and
Could you
they're going
imagine?
back to school in January. So that's a full year indoors.
Yes.
It
Yes.
will be very traumatizing to the mental health of that child. So how
Mm.
would you advise parents to go? How would you advise them to get over their fears, their own personal fears, and stop reflecting them on their children,
Yeah.
and let their children also understand the disease, understand what causes it, educate their children so they are empowered with information to
Mm.
always protect themselves. Even when you're not there, train your child to
Yes.
protect themselves. So how do we go about that?
Absolutely. I mean, you've said it even better than I could probably have said it. That the first thing is about realizing it's an unusual time in the history of the world anyway. That nobody expected that at this time last year, when everybody was making goals of 2020 in December, everyone was, yeah, this is gonna be my year. It's gonna be the year we do ABCD. Then now everybody's in the house. Huh? So nobody expected that even for parents themselves, they'd have to be in the house and probably even with their children longer hours than they'd ever even imagined. So it's definitely a challenge, not only just for the children, but even for parents, because parents are now saying, how do I fend for my family at the same time take care of my family indoors? Also, like, imagine if you're being told to work from home, like right now, all of us on this Zoom platform. Can you imagine for the people who are at home and with their children next to them? Someone is seeing mommy sitting over here in front of a computer talking to it, but they're not engaging with me. What is this? So it's stressful across the whole family spectrum. But for children, it is especially annoying, and especially doesn't make sense to them, because even by the time you say coronavirus, they really don't, it's not something that is close to them, because they don't see the effects necessarily the same way you can understand them in an abstract kind of manner. So to just echo what you've said, Dr. Kalondu, it's about informing children about the effects of it, finding out, is there a way the child can actually get windows of having fresh air, necessarily with with the physical distancing we're talking about. Is it possible for the ones who can afford it to take your child somewhere where you actually have some place where you can actually sit with them, or spend time with them? I've seen Kenyans doing a lot of creative things. If you drive on the northern bypass or the eastern bypass, you find that families are now sitting outside with their families and having kind of picnic setups, which are probably not just eating anything, but sitting down and spending time with their children in fresh air, because children cannot be confined, like you've rightly said, for a whole year. And I even can venture to say even longer than that 1 year. It's not going to be possible. So I think for parents, the only encouragement I can give you is, look, children are more resilient than you think. And in fact, let me even tell you something else. They're more resilient than you. For you, you're the one who, over the last 40 or 50 years of your life, you're the one who's been socialized a certain way, that people should do the following, should do the other, should do the other. But children are very malleable. They're pretty open to change. So when they see a situation like this, they'll be stressed in the beginning, but then they'll become creative in how they spend their time and what kinds of things they do. I know a lot of parents have started now turning on TV the whole time, or internet, but that's not the answer. If you allow children to actually be children, you'll find that they have other ways that are safe for them to interact. safely in. And I know sometimes I might be even speaking from a point of privilege that maybe if you have a compound, they can run around. But if you don't have a compound and you come from a place that is enclosed or there's not enough space, then that's where the challenge comes in. How do you really engage your child, and how do you make them burn that energy that is in their bodies? So I think we'll just have to think creatively together about how to do that. But the most important thing is to not lie to your children, not to become the kind of discipline that we grew up with, where you're told don't do something, but you're not given the explanation why not to do it. It only arises, raises curiosity. And for children, that's the worst thing you can do, telling them don't do this, but then don't tell them why not to do it. Tell them it's about your health, it's about your life, it's about protecting you, it's about protecting your brothers and sisters, it's about protecting the baby if there's a baby. So there's a way you can talk. And the last thing I'll say about children is about addressing them at their developmental need level. Because children who are 3 years old cannot be talked to the same way a child who's 9 years old will be talked to. Neither can be talked to about the way a 15-year-old can be talked to. So if you look at the whole spectrum of development, I think that the challenge of children who are school-going age is the biggest one. And then, choosing the words and what is appropriate for them or inappropriate for them to be told. So I think for me, that's how to disseminate information to children. It's not going to be easy. I'm not going to lie that after you do this now, then things will be perfect in your house. In fact, what will happen, you might even have a nice session. You feel like you've had a good kumbaya session with your children. Then tomorrow they're out with their friends. Now, you have to now also remember that now it is the age of parenting. I think I was talking to someone earlier today, the interview I was doing earlier, and I said that probably now Kenyan parents have now been forced to become parents again. And I think this is where the challenge will have to begin. How do you parent your kids? How do you make sure that they actually remain your children and they listen to what you say, but not in a harmful way to them, not in a stressful way to them, but also allowing them to have their development continue. Thank you.
Okay, thank you. Before I let a few participants who've raised their hands to ask their question or make a comment, there's an interesting comment from an anonymous attendee, and the person is saying, thank you for sharing. I feel that any level of stress to any member of the family may stress the others in the same family. I've decided that at times I'll just have the children in the car and drive around to watch the buildings, trees, and people without taking them out to the malls, then drive back home. I believe this will help.
That's brilliant, Doc. I think that's brilliant. If you have that privilege or the ability to do it, and that's why I was saying that it is not practical to confine children in a space for a whole year or a year and a half. If you are privileged enough, if you are fortunate enough or blessed enough to be able to have a vehicle in the first place, or to be able to drive around, and you have your health in order, I think that's a good idea. And that's what I was saying, that, I've seen families already taking that idea and even enhancing it by taking them to a place where they can sit down in a park somewhere with social distancing, and they're just enjoying nature in ways that families in Kenya had not been doing for a long time. So I think that we realize that it is very easy for families to become prisoners in their own homes, however beautiful they are, if you don't allow children to go outside and have have fresh air and just interact and see new things and comment about what's happening outside without coming into contact with people. It's unnatural, of course. Nobody says it's easy, but given the state of where we are right now, we don't have a choice but to really say, can we do that? And can we help each other by, probably just looking at it and saying, okay, it's only for a short time, but when things go to normal, we'll reconvene with people like normal. Thank you. That's a really good comment from the attendee.
Thank you. Thank you to the person who's given us the suggestion. It's a very good one. Thank you. To the people who raised your hands, please unmute yourself, ask your question, or give your comment. We're almost coming to the end of our session. So kindly unmute yourself and ask your question or share your concerns or give a comment. Now there's a few questions where I'm seeing people asking about where they can access psychological first aid training. There's Nelly, there's Douglas who's asking the same thing. And other than the KNH platform, are there any other platforms where they can access this service?
Yes, they can. What you could do, I think Dr. Kalandu, with your permission and Dr. Kinuthia's permission, you can even say if anybody is interested in PFA training, if they can register, okay, What we can do is that probably I can also come up with a way of them to register, and then we
Yes.
can actually have, no matter where you are in this country, whatever corner you are, it would be really great. Then once you register, we can actually mount the training for you. Okay.
That would be good. Yes.
Yeah, we've always done the trainings, but now given the pandemic and the way things are, probably the format won't be the same. But I think because we're already here and we're already meeting each other, over 1,000 of us every week, I think for me, it's just only natural to say, okay, let's see how many people are actually interested. And then once that's done, let us mount the trainings. And I can be able to organize that. Huh?
Yeah.
Thank
You.
you.
That would be very good. And also that addresses the questions from Teresia Maina, who's asking how we can encourage healthcare workers to seek mental health services and psychosocial support services. So once you organize that platform, I hope you'll be able to share with us how to get on it so that we can share it with the participants. Whoever is interested can be
Absolutely.
able to join that platform.
That would be a great privilege for us, and I think we'll be able to partner very well to do it. I think there's no person that's more important to learn psychological first aid than healthcare providers, because the people you see, no matter what it is they're going through, sometimes has a level of distress attached to it. So I think it's an important skill to have, whether it's about COVID or whether it's in the work that you already do. It's a big skill enhancement for us. So I think for both COVID, pre and post COVID, for me, I think it's a really good skill to have anyway. So we'll do that, and I think we'll partner very well to do it. Thank you.
Okay. Thank you for that. There's a comment from Mumina, and she's saying the anxiety and stress COVID-19 is causing to the family of the infected person is much because they're not getting proper communication and support. I think we need to give psychological support to the family. It must be part of the healthcare service delivery. We look forward to your conversation next week because we need to address this issue. As you said, somebody is well on Monday. On Tuesday, they're unwell. You can't go and visit them because they're under isolation and they're in hospital. Then on Wednesday or Thursday, God forbid, you're called. The person is no longer there. And on Saturday,
my goodness.
yeah. So it's very traumatizing.
Completely. So I agree, and I think for me, next week will be very key because now we'll bring our Kenyanness into the front. Because it's really good to understand what this and you see the thing about funerals and burials, they're very culture specific. So the way they're conducted in some communities is not the same with others, even religion wise. So it will be a very, very important communication to have.
That's true.
Yeah,
that's true. And it would also be good just to hear from our Muslim brothers and sisters, because for them, they usually do it very fast. For the rest of us, we're used to staying for a week, 2 weeks.
Exactly. 2 weeks, even a month.
Even a month. We're waiting for people to still come from far and wide. So it's culture shock. So we need to talk about it, and I'm excited about next week's conversation.
Great.
Sylvester is asking whether we have any interventional guidelines to address priority mental health conditions. Do we have anything that you're able to come up with?
Well, I think that's a good question. I think what we might want to explore is to say, is it possible to, how can I say it? Maybe the guidelines that are there with the Kenya Psychiatric Association, I think that's who we can actually talk with, and also look at also the other psychological associations like Kenya Psychological Association, Kenya Counseling and Psychological Association. So starting with the psychiatrists, because I know for them for the longest time, because of the relationship with KAMA, they have guidelines that they've been having for a long time. So we can look at those and see what are the protocols that you might actually use, and especially I think facility-wise, there could be guidelines which you can actually help to, we can look at and see if they're there. As at now, I don't know. I'm not sure if KNH has those, but I know that at Psychiatric Association level, I think they should have some guidelines, which I think they shared. Was it last year or the year before that? So if I get my hands on them, Dr. Kalondu and Dr. Kinuthia, I'll share them so at least we can disseminate them to our participants.
All right.
Yeah.
Thank you for that. I'm not sure whether we have any in KNH, but I'll also find out more about it.
Perfect.
Yes. Jael, would you like to unmute yourself and ask your question? Jael Jamedi. Rema Wanyama, Kenneth Mutai, Beatrice Amugune, Alfred Langat, we're coming to the end of our session, so I'd like to hear from you. If you have a question or a concern, just unmute yourself and ask. There's a question about, let me just see, there's one more comment. Kerry Owino, you're asking about a patient and whether the patient should be subjected to COVID-19 test. I know right now we're talking about telehealth and we're advising people to embrace it, but Kerry, unfortunately, we are not in a position to tell you yes or no. The patient, as you're saying, has visited a health facility. Please advise them if they're still feeling unwell to go back and seek care. If the patient is still unwell, kindly advise them to go and seek care in a healthcare facility. We cannot, unfortunately, tell you yes or no, as much as we're talking about telehealth today. Some of these things you just need to see the patient and see what the chest pain is, what might be the cause of the chest pain. Okay, there's a comment from Judy Mashuka, and she's saying, thank you for the elaborate presentation. While local Kenyans are already showing creativity in communicating positive messages regarding the pandemic, using performing and still arts, and in developing innovative strategies to manage COVID-19, to what extent are the guidelines and policies being developed to harness this contribution and ensure they gain ground in everyday living, including health interventions?
Well,
Yeah.
that's a good one. I think so. So to me, so I think one of the strong things that I've seen since the beginning of the pandemic was that everybody felt responsible and they felt they have a role to play in helping Kenyans. So the Ministry of Health, in conjunction with the National Counterterrorism Center and other partners, came up together with communication strategies, which are now targeted towards the youth, targeted towards different constituencies of Kenyans, especially because they realized that, you know, some of the communication that was coming out was probably just targeted towards national information more than behavior change communication, like we talked about earlier, a bit, I think 2 weeks ago. So right now, we are looking for those young people as well as opinion leaders. I talked about influencers, but influencers in the community, real ones, not the ones just on IG. Yeah? We're talking about people who actually influence thought and thought processes in the community, and saying that if these people can be the ones who are used to actually communicate messages, it's very important. For instance, I want to say this right now, and I know people might think very differently. I thought that the piece that was done talking about Kenyan men to some degree had a bit of truth to it, but also was pretty unnecessary. And I'll tell you why it was unnecessary. It was unnecessary because of the question of stigma. We've just lost people we know, and it's almost like saying that X and X person died because they were not washing their hands, and because it's almost like blaming people for getting the infection. I think we really need to get the right people to communicate. And I think that no matter what the intention had been, we really need to be careful about how we communicate to the country about issues that are serious like these ones. We're trying to get it right still. And I think it's important to say, can we have a man tell men that they're not washing their hands? It's very important. At that point, guys will listen. You know, if another man is one telling you, probably you listen a bit more, or even the tone you use when you're addressing them will matter. Now, I'm not saying that what was communicated was wrong. I'm just saying that an example of how to communicate has to do with the believability of the person who's transmitting that message, and even the creativity that you've talked about, the still arts, the whatever. Am I enjoying what I'm listening to, or is it just a song because it's just a song, you know? So for us, I think we have a really good opportunity to harness these talents. We've talked about that the country is owned by the youth. In Kenya, 61% of our people are under the age of 25. Believe it or not, 61%. That's a huge percentage of people. And we can actually use what they have in terms of creativity to tell us and to capture this moment in history and to help us to get through it together. So thank you so much for your observation.
Thank you, Dr. Gido. And yes, I also watched that clip where somebody talked about men and why they're getting COVID-19 disease. I've seen a question on that. I don't know whether that was the truth, why more men are getting affected or infected.
Exactly.
But as I agree with you, though, the packaging of the message is very important.
Very, very, yeah.
Very, very important. Sometimes you might be speaking the truth, but the way you package it might actually not be in a sensitive manner, in a manner that is well appreciated.
Yeah.
And
And
sometimes you're just speaking your opinions. And actually, that's what I agree with you. Most of the ambassadors, in
yeah.
quotes, or the
Yes.
influencers are talking about their own opinions, not
Yes.
scientifically proven facts.
Yeah, and that's what's dangerous, Dr. Kalondu,
Yes,
for that kind of level of communication, because
yes,
people might take it very seriously or might take it very emotionally,
yeah,
and even as David Jasira is asking in the questions about why is it that it's more men who
mm,
seem to be infected by
mm,
COVID. There are many
yes,
studies that are telling us why that is the case, huh?
yes,
And they're talking. Of course, there's a genetic difference or differentiation between men and women. And
mm,
for you healthcare workers, more than anybody else know that even conceiving a boy, okay, let
mm,
alone even having them develop and be born,
mm,
the conception of a boy is really, really tough sometimes. The Y chromosome already is hit by a lot of other things in the environment and not really given the best chance to survive. But even outside the body, we know that men are more vulnerable biologically than women
mm,
are. And so we don't know whether some of those vulnerabilities that we know are what are contributing. I think what I've learned, because I'm a psychologist, I'm not a geneticist, and neither am I a chemical engineer. I don't know any of those things, and I'm
mm,
learning, and I'm a hobbyist. But what I
mm,
can say is that if we take an open stance to just learn more as we go along, it might actually help us to improve the health even of our men and our women and children. Because if we learn that probably any class of people is more vulnerable, then we protect them, isn't it?
yes,
So instead of chastising them, we say, like right now, we're not going around saying, if you have diabetes, it's your problem. You're the one who got diabetes. So in fact, if you get COVID and you die, that's your problem. You know what I mean? So it's
mm,
really, so to me, the way we communicate has to be sensitive. It has to realize that human beings, nobody wakes up in the morning wanting to get a diagnosis of anything.
that's true.
So just to be sensitive and to realize that, yes, maybe there is behavior change that is required. But then how we do that, like we said from the behavior change presentation, it's about persuasion and not coercion. So you
Mm,
cannot coerce people and expect they're going to do behavior change. But if you persuade them and say, okay, let's work on this together, then probably you'll get a more positive outcome in it.
that's true. Thank you so much for that. And once again, you brought out very clearly the danger of everybody opening a social media platform and just sharing their opinion. And it's
True.
true, that's what is happening right now. There are so many opinion speakers and influencers out there. Thank you for that.
Yes.
Um, to finalize this session, there's a comment from Ombiro Marera, and is saying telehealth is the future in health. We better start embracing it early. Thank you,
Yes.
Ombiro, for reminding us that. And as I've said, if you have any innovation, any ICT or technological innovation that you might have developed, or a platform that you feel we need to have a conversation or you need to create awareness about, we are ready and willing to give you the platform to come and share your idea. And we're excited to see all these innovations that are coming up. We're very excited, and we wish you all the best to the people who are cracking their brains and trying to innovate something. We wish you all the best as you try to innovate something to help us in the healthcare industry. Dr. Gilwa, once more, thank you very much. We
Thank
look
you.
forward to next week's session. I'm sure it
Yes.
will be very exciting also, just to learn how to deal with the different cultural perspectives that we have and the new way we are doing things.
Yes.
And there's also a question that I've seen about people asking about closing of bars, how men can be helped to deal with that. So as you finalized your last comment, you said about persuasion, not coercion. So
That's right. Yes.
yeah, so we need to persuade the men that it's not the end of the world.
Yes.
Just because Kiambu County said by Friday places must be closed,
My
the
goodness.
Ministry of
Yes.
Health issued another guideline, and we need to be the agents of positive messaging
True.
to our relatives who probably are going through so much right now. To our
Mm.
brothers and sisters, let's be the change agent for creating positive messaging and supporting their mental health. Thank
Correct.
you very much, Dr. Guido, once again.
Thank you so much, Dr. Kalondu. It's always a pleasure for me. And I think that the more and more you have these platforms, I'm also learning a lot by even the kind of questions that are being asked, the contributions. It's really a life-changing experience for myself and my team. So thank you so much for this opportunity as well.
Thank you. Now, to the rest of the participants, I'd like to thank you for attending this webinar. I hope you've learned something from it. Just a few questions. Martha Gesora, yes, I can see your name, or is it your phone's name? Yes, I can see that. Candy, and there's somebody else who asked whether they can invite a colleague to the sessions. Yes, please, by all means. The more we are, the more we hear this message, the more we're able to create change in our own little small way. So feel free to invite your colleagues to attend the session. Rose Njoroge, you talked about WhatsApp messages. That has been a privilege that has been, Dr. Kinude has been very diligently and elaborately doing for those of us who are within KNH. But due to some of the challenges that we had this week in getting some of the speakers on board, some had not yet confirmed until last minute, we were not able to create that. But going forward, it is not a guarantee that we will be able to send you WhatsApp messages, but you will always get the emails. So thank you. Thank you for listening, Rose Njoroge. For the people who are asking about CPD points, for the team, there's somebody from nursing. Yes, Danish Omoro. Danish Omoro, we have not yet been able to roll out the token system from Nursing Council of Kenya. We are still working on it, how best to get them to give us the token so that we can issue them to you. But if you're within Nairobi and you're able to pass by through KNH, we can sign your booklet. If you're not within Nairobi and the Nursing Council agrees that an email would suffice that you attended a session and we can confirm that you attended the session, kindly let us know in writing and we'll be able to send you the email. That is if Nursing Council of Kenya agrees that that would be enough as enough proof of attendance. But at the moment, they've not been able to give us the go-ahead to issue tokens to the members of NCK. To my colleagues from pharmacy, brothers and sisters from pharmacy, we are still working on your issue. I hope there's been a bit of improvement because from 15th, we've been promised by the PPB that we'll see some change. I don't know. If I'm not a pharmacist, so I'm not able to see whether it's now a bit faster or better on your end, but only you can tell me. But so far I can still see that we have a few complaints regarding CPD points for pharmacists. So please let us know. Don't shy away from letting us know that you're still having challenges so that we can engage PPB more and learn from them and see how best we can streamline this. So thank you all for attending today's session. Tomorrow we have one session, the sharing of experience. Please log in to hear what your county has done, how they're prepared, and what the other counties, your neighboring counties have done. On Monday, we will be talking to patients. This one will be a very interesting one. Please log in to hear what the patients who are on home-based care at Mombasa County have to say about it, the experience they've gone through, the positives, the negatives, and what we can improve. So in your county, as you're rolling out home-based care, you'll be able to learn from the patients on how best to roll out the home-based care and the Jitenge app. So thank you so much for attending the session. Bye.